What's up, beautiful people? Another day, another study. I'm about to give you another reason why strength should be one of the primary things you focus on in your health and wellness plan. We've talked about hand grip strength before. It's something that I measure in all my patients. There's a correlation in studies to all-cause mortality, to all-cause dementia, to frailty, falls, all of these things. It's a very, very important, quick thing that you can measure with a dyno. I ship one to my clients, and if it's low, we offer strategies to improve that. Anyway, this study was looking at the correlation between hand grip strength and age-related macular degeneration. It's a very common visual disorder that we see in people as they age. It causes progressive visual loss. And hand grip strength is something that we measure for strength, as I just mentioned. Now, this was using data from the UK Biobank. They had nearly 400,000 participants. They followed them for a median of almost 13 years. In the fully adjusted model, every 5 kilogram lower hand grip strength was associated with a 6% increased risk of AMD. When it was adjusted by sex, women had a higher risk of low hand grip strength being associated with AMD than men. And they broke them into 5 quintiles. And when they looked at the highest versus the lowest quintile had a 25% greater risk of AMD. And they proposed some mechanisms for why this happened, possibly related to inflammation markers. There have been studies associating hand grip strength with inflammation markers. It's also possible that it's a neurovascular problem. And so in their mediation analysis, they looked at 8 inflammatory markers and 4 red blood cell markers. They found that these 8 markers mediated about 37.5% of the association between hand grip strength and macular degeneration. Of those, CRP was the highest mediator, followed by hemoglobin and hematocrit. This is important because as we age, we tend to see anemia, and that can be for numerous reasons: decreased B vitamin absorption, especially B12. There also can be lower intake of iron, medications, numerous reasons. So it's important not only to look at our hand grip strength, but also to look at these markers that deal with inflammation and red blood cells. These are all things that I check regularly and interpret. And these findings were in line with a previous meta-analysis showing low physical activity was associated with a 19% increased risk of early AMD. So, are you testing your strength? Are you doing strength training exercises? If you're not, that's something that you should be doing regularly to see if you're at risk. If you want to know more about this, this is something I offer in my business when I do my health risk assessments. Creating a plan based upon your lifestyle, your genetics, and your blood biomarkers, showing what you're at risk for and how can we mitigate that risk. These things are very, very important.